What's going on, guys? Coach Jake here. Got a quick one today around some IT band strategies. If you're somebody who's been told that your IT band is tight, if you're dealing with some knee pain, some hip pain, maybe you're an endurance athlete getting out there, getting those miles in, and this is going to be a great video for anybody who is struggling with strategies around that big old connective sheath that we call the iliotibial band. And if you're an anatomy nerd like I am, starts up here around this big elephant ear bone of pelvis, which we call the ilium, comes down the entire leg, broader up towards hip, gets really, really narrow as it comes down and crosses knee here, and then connects right into that big bone of the lower leg, the tibia. I still get people who are into the idea of rolling this structure out and getting directly into that surface. That is something that I never recommend. IT band is not a contractile tissue, it does not contract, does not respond that soft tissue input like the rest of the muscles do. But working directly on this outside surface is a good way to make that work a hell of a lot more uncomfortable for you and not really get any more return on that investment for that increased discomfort. So if you're a masochist and you want to get in there, go for it, but don't feel like you're doing anything for yourself. So instead of rolling directly on top of that structure, we're going to focus on some of the stuff that ties into it directly. So today we're going to talk tib anterior, kind of stuff just below knee here. We're going to go over some quadricep work and very specifically vastus lateralis, which is this very big outside quad. Most of it actually lives underneath IT band directly. We have to operate with a little bit more finesse when we're trying to get into that. And we're going to go over one of the big, small but mighty hip flexors here on the outside of the hip, TFL. And we're going to go over some glute stuff for you here too. So just like always, we're going to start with a little bit of a bigger tool to do some warming. And let's get rolling with some quad stuff here. So I always do recommend starting at one length of that area that we're trying to address and get into and work from one end to the other. The idea is we're trying to search things out, kind of do some road mapping, figure out where those big hot spots are for you in the soft tissue and spend some good time working with those. So you can be up on hands and fists like this if that's feeling good for you. If you want to get down into a little bit more of kind of a modified plank position, that's all good too. And what we're going to do is start just getting some nice, big, broad pressure working through quadricep here. And we're just doing a little weight shifting back and forth from hands back onto tool. If you want to, we can keep that pressure consistent and work with some active movement, figure out what's speaking to us at that given time. Right, so we're gonna keep working our way up towards hip here, slowly searching that stuff out. And as you can see here, I'm just dropping thigh directly on top of that tool there. Gonna be quadriceps here, those big prime movers in knee for us. A little bit of hip action as well. And then when we get all the way up into pelvis here, I want you to think about getting into kind of a side plank position here. We're trying to work with some very perpendicular pressure. So we're coming straight in from the side here to get after this hip flexor TFL, which is one of the primary muscles that ties directly into IT band for us. So spend a few minutes working up and down these lines. If we're hanging out on TFL, that hip flexor, you can work with some hip flexion, some hip extension. So pull knee up towards chest, straighten leg back out. TFL also provides some internal rotation for us. So internal, external rotation, also not a bad idea. And then once that stuff's feeling warmed up, you feel like you got some blood flow going, we can grab a smaller tool to get into that specific time. So I got the orb here, Therapy Ball Plus from Tune Up Fitness. These are two very, very good options. If I'm trying to work quad here, we're gonna live right on this top kind of outside corner and edge as we work up through the thigh here. So if you can find this kind of meaty, bony spot on the outside of the hip, and then we're drawing straight line right down to the outside of the knee here. Again, just get nice and comfortable with hands and arms. Want to feel nice and stable, nice and supported. And then we're just running that same rhythm again, hanging out in those good spots, anything that's feeling tender, sensitive, sore, anything that's creating some referrals for us. So we could feel these guys working down towards knee a little bit. It's going to feel like an achy, kind of pulling tension sensation. Can also send some stuff working up towards hip here as well. And we can also access that big quad muscle, vastus lateralis, or the backside of the thigh here. So to do that, so we got big hamstring tendon right here. We're going to come in between that and IT band. And you'll know you're on top of IT band if it's feeling super ropey, just feels like a big old steel cable kind of working up and down the leg here. And again, starts very narrow down here at knee and widens as it works up towards hip here. So we're really going to target this underside here. So this is big hamstring tendon right here. And then this kind of groove right here. So you can work directly on ground. Seated is also a good option. And we're just going to tuck that tool right behind the leg here. And we can get some good work done in this position as well. So you can start right down here at knee, and we can bring that work all the way up into the back of the thigh and up into some of these hip attachments that live in the back of the leg here and the back of the hip. So find those good spots, shimmy, shimmy, shake, shake a little bit on top of those, or hang out with those until they're starting to feel a little bit better in an ideal scenario. If you got the time, invest it, but if not, try to think about 2 minutes as a good minimum effective dose. Another one of my favorites for right here behind me is just to take that ball, close knee down on it, and then you can just lean right back into this to provide some good input. This is a nice one. You can keep working up the thigh a little bit here, and the further you lean back into that, the more it's going to get that pressure and that input going into the back of the leg for you. Now, below the knee, we have our attachment right here into tibia. And to get into this, we're just going to position this ball right here in this meaty stuff below knee. So we don't want to be right on top of the bone here. So bony, 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 and then we get into some good soft tissue right there. Think about kind of like a pigeon pose from yoga, 90-90, shin box position, and then we're just sneaking that tool right underneath the leg there. More often than not, I'm going to bring a hand on top here to just help get a little bit more input and pressure in there, but if it's feeling good without that, that's all good. And again, We're going to work with a little bit of active foot and ankle movement. So really think about pointing toes down towards ground, stepping on the gas. You can pull toes up towards nose. All that's going to help that tissue open up into some different angles and get some good work done for you. And this is often an overlooked and neglected group of muscles on the outside of the shin here. If you're a serious athlete, a runner, any of that stuff, and you're interested in peak performance, I would highly, highly encourage you to be checking in with the outside of the shin here and to also be directly training it. Now our last muscle group that we're going to be focused in on here today is glutes. And again, we're just going to start with a nice big tool. I got the orb here. Different hand positions are all good, body positions. I'm not shaped the same way you are, so if this looks a little bit different for you, that's not the end of the world. And spending some good time in there. So just nice little controlled motion like this. We're really trying to be intentful and intentional when we're spending this time around the tissue. So once you're done with your big tool, might be catching on to a theme here, we break the smaller one out. So I like the same position with the smaller tool here. You can kick both hands behind us. And I got some good pressure and input. That's a good spot for me this morning. So we can work with some external and internal rotation. So we're gonna drop knee down to floor. We're gonna come back to starting position. We can work on some hip extension, so straightening leg out. And then last but not least, hip flexion, pulling that knee up towards chest. And that's gonna get a nice lengthening action in that glute muscle for you. Now glute can refer, again, down thigh, can wrap around into front of thigh here, into these quadricep lines, can work directly down the back of the leg through hamstring. And then it also has the potential to send some stuff working up here into lower back as well. So if we're working around the back of the hip there, always be on the lookout for those big achy sensations, traveling away from that area of pressure. Those kind of lines of tension, pulling. But the general rule of thumb is anything that's really kind of resonating with you, anything I like to say that's speaking louder than other spots, is a good spot to spend some extra time and attention in. Now we do have that big sciatic nerve traveling through back of hip here. So if we're ever working in back of hip and you're feeling numbness, pins and needles, big electric sensations, anything sketchy at all, we want to get out of that spot and shift our position, our angle of pressure. All that stuff is feelings and sensations that we want to try to stay away from as much as possible. The idea here is that we're creating good discomfort and giving the body a chance to increase some awareness and respond and adapt a little bit to what we're doing there. That's it for today, guys. Remember, if you're rolling on top of IT band still, you're not getting any more return on that investment for that increased pain and discomfort. To check in with all those tissues surrounding it. Have a good one, y'all.